Hi, my name is Dave Holmes. I'm an advanced EMT with Mount Hope Fire Department. Today we're going to talk about using a Cpap device. The one we have here is made by Mercury Medical. It's a disposable manometer, and the PEEP is controlled with the oxygen tank according to the chart that's on the hose. The other device that's on the table is the head strap if needed for your patient. Certain characteristics of your patient that must be met is your patient must be awake unless you have end-tidal CO2 monitoring and you can monitor waveform continuously. Your patients must be above the age of 12 years old, have an open airway which they can maintain themselves, and their blood pressure must be above 90. To meet the criteria for a Cpap device, your patient must meet two of the following criteria. The patient must be breathing 24 or more times a minute. The breathing with retractions or use of accessory muscles, including nasal flaring. And they could be speaking a 1 to 2 word dyspnea. Counterindications for a Cpap device are going to include respiratory arrest, hypotension, a suspected pneumothorax, a tracheostomy, a foreign body airway obstruction, facial trauma, chest or head trauma, as well as recent facial, neurological, or gastrointestinal surgeries. Complications that can arise while using a Cpap device is a tension pneumothorax, severe hypotension, aspiration, gastric distension, or anxiety from the procedure itself. Before you use this device on somebody and going through the procedure, you want to explain to your patient what you would like to do. Tell them that you have a device that's going to help them with their breathing, it's going to blow air onto their face, and it's going to make them feel better. After that, you want to set up your device and turn your device on and check your oxygen level. After you've told the patient what you'd like to do, you'd like to double check your vitals and monitor your patient. You're going to have a pulse ox on your patient for the entire time that you're doing this procedure. You want to try to sit the patient up and have them help you hold them fast to their face. This is going to be where you can see if the patient's going to accept this mask or if it's going to give them a little too much anxiety. Once it's on the patient's face, you want to coach them to breathe normally and try to take deep breaths. What that's going to do is going to help get that air into their lungs, and they're going to start to feel a lot better as the procedure goes on. After about 3 to 5 minutes and the patient seems to be accepting the device, you can apply the straps and check for leaks. And you're going to want to keep monitoring this patient's vitals the whole way to the hospital and during your entire transport. So you take your handle in. Do you have any leaks around the edges?